Is TMS therapy controversial? Like every new treatment, TMS was viewed with skepticism after it was approved by FDA. As more data about its efficacy became available, skepticism was replaced with acceptance. Today, the use of fMRI combined with TMS is receiving attention due to its recent FDA approval for depression. Under this protocol, a single region within the brain is treated 10 times per day for 5 days. At Neurotherapeutix, we have developed accelerated TMS treatments for many disorders. These can be delivered without compromising efficacy over the course of a week. Optimal results for neurological conditions such as stroke or dementia will benefit from additional treatments and long-term maintenance.